today's event, we are looking at the topic of neonatal and prenatal testing for rare diseases.
Newborn screenings gives us the opportunity to identify children before they become ill, and that's absolutely pivotal. So when these children are born, they look very often perfectly normal, they behave entirely normally, and unknown to anyone, they have a serious and sometimes life-threatening condition. And what newborn screening enables us to do is to detect that before they become ill and intervene and treat them. And that treatment is truly life-changing for those children.
So essentially the test hasn't changed. It's still a pinprick.
So since then, that tiny little bit, 2 to 3 millimeter punch of blood on a filter paper, we can now screen for over 50 disorders on every baby using that same tiny little bit of blood. So that's where the major technological advances have been in terms of the ability to use different machinery, different technologies, and get even more information to try to make early diagnoses. In addition to doing those tests, we can also do different types of testing on that dry blood spot, including DNA-based testing and genomic-based testing. So the changes and the improvements have been vast and really exciting to see.
I think it's important to highlight the difference between the screening tests that was nicely described by the others in terms of trying to identify babies that are asymptomatic or pre-symptomatic for conditions. You know, Jim had brought up severe combined immune deficiency and Melissa had brought up PKU, or both of them had talked about PKU. And those are conditions where you might have a baby that's well, but at risk for these severe complications. And with insight into the condition they have, you can then in many cases have life-saving treatments.
Is every child in the world tested, or are there still parts of the world where no testing is done?
Unfortunately, there are still some parts of the world where no test is done. I would say that in the developed countries it is in place, and also I would say most of the developing countries there are some kind of screening, but there are some areas where newborn screening is not performed, or at least it's not a public health policy. Mm-hmm. So there are still lots to be done to have newborn screening as a global initiative.
So the big question is it time for us to rethink those criteria and that definition of benefit? Should newborn screening still just be for the benefit of that baby? Should we make sure that there is always a treatment? Or can we also think outside the box a little bit? Is there a benefit to the family? Even if maybe we don't have a treatment for that baby, but if that family now knows that, God forbid, there's a terrible disorder running in their family, maybe they could use that information to help for genetic counseling for the rest of the family.
The other difficulty with spreading the net wider in screening, and particularly into conditions where the child does not necessarily become ill until adolescence, is that you remove the right not to know. These babies that are being tested by definition without their consent or knowledge. And you're giving them information that's directly relevant to their lives as they grow up. And they've got no choice about that. They simply inherit that, if you like, because of a choice for their parents. So I think there are some real debates to be had, and this is going to become perhaps even more topical as we begin to use that tiny drop of blood. We have the potential to use, as we said, that tiny drop of blood on a filter paper to do perhaps whole genome sequencing. And then we get into these very difficult areas for what is it like to have your life mapped out in front of you without your consent, and who has the right to do that. These are tricky issues. Mm-hmm.